I'm Dr. Kerry Fierstein, Chief Executive Officer of Allied Physicians Group, practicing pediatrician for 30 years, mother of 3, and now grandmother of 1. Hi, he came to say hello to you. He's in his jammies and he's ready to go to bed. And the one thing that everybody agrees on when you're having a new baby is that you're giving up some sleep, at least for the short term, certainly giving up those lazy Sunday mornings, but with some consistency and dedication, you can get your little ones sleeping through the night. For those of you who have little ones, you're going to learn. Exactly. For those of you who have little ones, you're going to learn some good habits. For those of you who already have toddlers and they're in some bad habits, you're going to learn how to break them. And now we're going to say goodnight to you. There you go. He was a lot quieter in my earlier videos, but now that he's 8 months, he's got something to say. And even for those of you who have elementary and teenagers, we're going to have some advice for you as well. There was a tremendous outpouring of questions for this night, which shows us that there's a lot of interest in the community. So I'm going to start by having our experts for tonight introduce themselves. The way it works is they're going to each give a short presentation, and then we're going to come together at the end for questions. If you have anything in the chat, put them in. We'll try to get them as we go, and we may use them as a question at the end. It's going to be really hard to answer specific questions about your exact circumstances. So if you can keep your questions a little more general, you'll probably get them answered tonight. Let's introduce Seema.
Hi, everybody. Thanks for having me on today. I am Seema Bhambri, and I am a sleep consultant based here in Plainview. Both my kids, 11 and 7, 2 girls, are Allied babies. And I've been doing this for 4.5 years now, and I love it. I love getting parents sleep again, working with them one-on-one, more with, you know, writing plans for them and getting them sleep again. Yep. So looking forward to answering some questions.
And Zeenat?
Hi, everyone. Thank you so much for having me. My name is Zeenat Hameed-Zaman, and I am the founder of Sleepy Little Z's, Baby Sleep Consultant. I'm also a mom of 3 kids. My twins are going to be 3 on Valentine's Day, and my littlest is just about 9 months old. Like Seema, I also love helping families regain some sense of control by having better rest for their babies and for them, which overall just helps them enjoy the wakeful hours that they have together a lot more.
And you are also an Allied mom.
I am. All 3 of them go to Allied.
Dr. Montague.
I'm Dr. Janice Montague. I'm a private practicing general pediatrician, and one of my loves is talking about sleep. And as you guys just said, it's all about control and gaining back your life. And I love talking to parents about it because they feel so empowered when we can actually get somewhere and make a plan and then see it through to fruition. And parents come back and say, oh my goodness, I have my life back. So it's doable. And I love chatting about this with families. I also have 2 kids, but they're much older. And as I was just saying, we are sleep training a new puppy. So that's sort of relevant tonight.
Thank you. Zeenat, take it away.
So the first thing I want to talk about with you all is safe sleep guidelines and SIDS prevention. With a newborn especially, this is the most important piece of the puzzle to remember to ensure that baby stays safe. We want to always put baby to sleep on their backs because it's the safest position. No tummy sleeping or side sleeping. Along with that, it's encouraged for newborn babies to share a room with you. This usually means in a co-sleeper beside your bed or a bassinet. It could even be a full-size crib in your room, but not in your actual bed because that is not safe. Their sleep surface should also be firm, which means it shouldn't be too soft or plush. It shouldn't have too much give to it. If you look at infant mattresses, they're pretty solid with just a slight bounce to it. Along with that, there should be nothing in the sleep space. So no stuffed animals, no blankets or pillows. Babies really don't need any of that. It's not safe for them. So just the baby in a swaddle or a swaddle sleep sack is the safest for them in their sleep environment. And then sometimes I think it's easy to just place them on the sofa if we need to run to the kitchen real quick or something of that sort. But any kind of sofa sleeping is also quite hazardous to little ones. So they should never be placed on a sofa or an armchair or a recliner of any kind. And lastly, breastfeeding. There are so many studies that show breastfeeding can help reduce the risk of SIDS. The AAP recommends breastfeeding for 6 to 12 months. But even if that's not possible, studies show that breastfeeding for 2 months, along with combination bottle feeding with formula, can reduce the risk of SIDS by almost half. Breastfeeding encourages the baby's body temperature regulation, helps with breathing rates and heart rate, and it also helps to transfer a lot of mom's antibodies through her milk to her baby, which helps keep baby safe as well. So when we're looking at sleep overall, there are so many different components that affect how well a baby is sleeping and what we can expect of them sleep-wise. The first one is age. A younger baby, a newborn, will require a lot more sleep than an older baby of 9 or 10 months. Along with that, we need to look at their feeding and their nutrition. So as a newborn, we have to see, are they getting enough formula? Is it too much or too little? Even breastfeeding, we want to make sure they have a good latch and that they're transferring proper amounts of milk for good weight gain. And then when age appropriate, that their nutrition is on track with solid introductions when it's necessary for them to meet their caloric needs and their nutrition, usually between 4 to 6 months. Along with that, their sleep environment. There's a lot of back and forth among people. I think I hear about sleeping in the light versus sleeping in dark settings. You might hear people say, oh, don't put your baby to sleep in the dark because it gets them too used to it. But really, science tells us that darkness does help babies sleep better because it helps with their release of melatonin, which is a sleep hormone that helps them sleep better. And when there's too much light, their bodies can't produce that, and it's not conducive to sleeping. Also, proper temperature of the room can help your baby sleep better if they're not too hot or not too cold. There's optimal temperature of 68 degrees to 72 degrees, which more or less will have your baby pretty comfortable. Some babies may run a little bit cooler, some a little bit warmer, but generally speaking, that's a good range to keep your room. Along with that, we look at routines. This is pretty important only because just like adults, babies like to have a set routine, even if it's not too structured, to have a general guideline of when to expect sleep, when to expect meals or milk. It really helps their bodies get ready for rest. The next two kind of go hand in hand, proper nap durations and max wake times. As babies get older, their max wake time increases as well. And if that's not being followed, a 6-month-old staying awake for only an hour and 15 minutes or so will make their naps a lot shorter. So we really do want to make sure that baby is staying awake just as long as their age allows them to. Staying awake too long or too little will impact the quality and duration of naps and overnight. And then lastly, we look at settling techniques. As a young newborn, your baby will most likely require a lot of hands-on settling from you, whether it's rocking or patting or holding them. That's very normal. And as they get older, it's important for them to learn how to settle themselves to sleep and then resettle themselves to sleep if they wake up in the middle of a nap or overnight. Are they using a pacifier? Do they need a bottle to go to sleep? Or are they nursing to sleep? All things that we look at when we look at overall sleep and sleep quality. So firstly, we'll talk about newborn sleep. A lot of the questions that came in were for a range of babies, most of them not newborns, but still, I'm sure a lot of us have gone through this phase already. So with a newborn, the first 3 weeks of their life, they are predominantly sleeping all the time, upwards of 16 to 20 hours in a day, probably awake long enough to take a little feed and then go right back to sleep. And that's totally normal because they still have the sleep hormone of melatonin from mom all in their system. It's very, very common for newborns to be that sleepy. And then within the 4 to 6 week range, you might see that they have longer periods of wakefulness, because by this point, the melatonin is no longer in their system. So it's normal for them to be up for longer than they were before, because they just don't have that running through them anymore. Their day sleep actually reduces a lot. So from before sleeping almost 20 hours a day, they're now only sleeping around 4.5 to 5 hours during the daytime. The next age group in the newborn phase is 7 to 12 weeks. And within this phase, they start producing their own sleep hormone at 8 weeks of melatonin, which will also result in them having more pronounced sleep cycles. So you might find that after a sleep cycle, they're a little bit more alert or moving around a bit. And their daytime sleep reduces even more to about 4 hours. With a 12 to 16-week-old baby, just as we have previously, it's important to continue respecting their sleep needs, just like we respect their eating needs. In order for a baby to properly grow and develop, both feeding and sleep are critical. As we discussed, a lot of times the pronounced sleep cycles may result in catnapping. And in order to avoid your baby becoming overtired, it's important to help them link those sleep cycles and get longer periods of sleep, because a catnap of 20 to 30 minutes at a time is not quite restorative enough for your baby to get during the day, and will result in them still being pretty overtired by the end of the day. And like we discussed earlier, the optimal sleep environment will help to ensure baby is sleeping well. So making sure the room is dark, that it's the proper temperature, that baby is dressed appropriately, and that you have white noise. White noise is actually a very, very helpful tool, because not only does it mimic the sounds that baby heard in mom's belly, it also helps to drown out a lot of outside noise. So for a nap during the day, it helps to really muffle all the things that are going on in the house outside of the room, and also helps to link sleep cycles for babies. So if they do come out of sleep cycle, that white noise kind of helps bring them right back into a sleep phase. Having routines at this age is very helpful. So baby learns to start anticipating naps and bedtime, and then increasing their max wake time. So if you are finding baby is still falling asleep after an hour and a half, it might be time to start helping them increase their wake times a bit, so that they're able to sleep for longer durations during their naps. Next, we have 16 weeks to 6-month-olds, so about 4 to 6-month-olds. This is the age where baby sleep is now neurologically mature. What that really means is that baby is now able to learn how to settle themselves to sleep. Before this age, baby completely needed your help to get to sleep. They didn't have the physiological ability to know how to put themselves to sleep. But at the 4-month mark, they're actually able to learn it themselves, whether it's through hands-on methods still, or a little bit more hands-off methods is completely up to each individual family. But either method would work at this point. And like every other age group, napping at the proper times for the proper durations is pretty critical in helping them sleep properly and for them to get the quality sleep that they need. Around this age, we still have to keep tabs on their feeding and weight gain, because you might find a baby will start needing more solids, the introduction of it even, because the milk is just no longer enough for them. And then when you do start solids, sometimes you may find baby has a little bit of disruption in his or her sleep, and that's normal too, because of the introduction of these solid foods into their little bellies who have only had formula or breast milk before that. As long as you stay consistent with your routines, it usually levels out and goes back to normal. And the beautiful part about this age range is that a lot of times you might start getting larger chunks of sleep overnight. baby's sleep at night has started consolidating, and so hopefully that means more sleep for you too. And then 6 to 12-month-old sleep. I do have a lot of clients that still wake up for milk between this age range, but physiologically, around the 9-month mark, if weight has been great up until this point, unless noted by your pediatrician, babies don't need to have milk overnight as long as they're getting enough during the day. So if baby is still waking up overnight, it's typically related to settling issues. Maybe baby doesn't quite know how to get back to sleep, and that bottle or nursing really helps to do that for them. Or it's become a habit wake even. Sometimes if a baby wakes at the exact same time every single night, it's likely a habit, but it depends on the child as well. But physiologically, they don't need the milk anymore. You might even find temporary disturbances in their sleep when it comes to learning new skills. So if your baby has just started rolling over or started crawling, standing, or walking, you might see them on your baby monitor, like I have with my own children, practicing these skills when they should be sleeping. It's pretty normal, although alarming at times. You wonder why they would rather be practicing than sleeping. But for them, it's something new and exciting. They just want to practice it as much as they can. So the best thing to do is to provide opportunities during the day for them to practice. And then as long as you lead them to it and they're safe in their sleep space, there's no reason to intervene. If your baby has started rolling, however, but is still in a bassinet or a co-sleeper, this would be a good time to put them in a crib because it's no longer safe for them to be in that bassinet or co-sleeper. Sleep props. This age group, up until this point, if they've had a pacifier or nurse to sleep or a bottle to sleep, this would be a really good time to start changing that, especially with the pacifier. Around 8 to 9 months, sometimes a little earlier for some babies, they can be taught to replace the pacifier themselves, which is good news for parents because you don't have to go do it yourself anymore. You can start teaching your baby to put that pacifier right back in and go right back to sleep. It's also a pretty good time to get rid of the pacifier completely. There's not a strong enough emotional attachment to the pacifier at this age. So around 6 months is a perfect time to ditch it altogether. And then resettling and settling your baby. A great time to start teaching them to do that because after 6 months, any kind of change in how you're putting baby to sleep might result in a lot of protesting from baby because they have just gotten the stamina to protest pretty loudly. And that is very normal. It's not uncommon for babies to do that. And then 12 months to toddler sleep. This is the age where milk is no longer the primary nutrition. So it's important to ensure baby is getting a well-rounded diet and milk is offered with meals rather than before or after meals. This encourages baby to get the most nutrition from the solid foods that they're getting. If they're not getting enough solid foods and still drinking too much milk, night wakes may actually be due to hunger. And so we really do have to look at the overall diet for that. And around this age, growth actually does slow down as well. So you may find your toddlers not eating that much in looking at their food, but they're pretty good at regulating how much they need and how much they take in. So as long as the opportunities are there for them to eat, they should be doing pretty well. And then overnight expectations. Each age range has varying expectations. A newborn from 1 to 12 weeks, they are sleeping often in the beginning, and then it tapers down as they get a little bit older, like we discussed. It's pretty normal for them to have long periods of wakefulness between 5 to 10 p.m. until about 6 weeks, and then that should disappear. And then from 12 weeks to 16 weeks, even an exclusively breastfed baby should be able to sleep from 7 p.m. to 7 a.m. the next day with just 2 overnight feeds is pretty typical. It's not so much dependent on formula versus breast milk that keeps them full or not. A breastfed baby could sleep really well, just as much as a formula-fed baby could sleep poorly. It really just depends on how much they're getting during the day. And then 16 weeks to 6-month-olds, a great time to evaluate if they're settling themselves to sleep or resettling, because this will really determine how well they nap and how they sleep overnight. And then 12 months to toddlers, they should be able to sleep through the night for 11 to 12 hours with no wakes. And any wakes that happen are likely due to settling and resettling issues and possibly diet. Babies with or toddlers with anemia may have sleep disturbances, so getting a quick iron check sometimes can be helpful, only if this is a persistent problem where baby just is unable to sleep at all overnight. And so keeping those overnight expectations in mind can really help set up for success. Having realistic expectations for your baby's age, ensuring that they have the optimal sleep environment, conducive to sleep, instilling healthy sleep habits for every routine before the sleep happens is really helpful to help baby prepare to sleep. Ensuring proper times for naps and bedtime can help ensure that baby is tired enough to sleep as much as they need to. And overall, remembering that everybody has off days. So just like we have days where we just can't get to sleep or stay asleep, sometimes we wake up frequently throughout the night. It happens to babies too. Sometimes there's no telltale reason for it, as long as you've had everything checked out by the doctor or you know that they're not sick. It's just sometimes they have a hard time, and it's okay. As long as you remain consistent with your routine and all that you're doing with your little one, sleep should resume pretty soon after. And that is it for me.
Okay, so I'm going to talk about kids between 18 months and 3 years old. I kind of went through the most common issues that parents come to me with. With 18-month-olds, it's often nap resistance. Kiddos are putting up a fight when it comes to nap, or they're not sleeping, they're babbling in their crib. And just the whole transition into sleep for nap it's a bit of a to-do. It's a bit of a struggle for parents. What I always say is remind them that, you know, kids at this age, they're starting to experience some FOMO. They don't want to leave their toys. They don't want to leave their favorite people that they're playing with. And often when I speak to parents, it's very often a matter of picking up baby and putting them right into their crib for their nap. So they're not having enough time to transition and make that connection that it's time to go to sleep. So like Zeenat said, routine is very key. You want to spend about 5 to 10 minutes making sure you're changing their diaper, putting their sleep sack on, singing a song, giving them a cuddle, and putting them into their crib. Also, what you want to do is make sure they get some outdoor play in the morning, whether it's outdoor, I know it's cold now, but, you know, get some opportunity, a lot of opportunity to exert some energy, running around, making sure they get some exercise in. Bedroom environment is very key as well. You want to make sure their room is clear of any toys, anything that's going to distract them going in for nap. You know, if they see their toys, it's again harder to make that transition. You want to make sure that the bedroom is conducive to sleep, and so that they know when they're in their room, it's time for sleep and rest. Darkness is key as well. Again, as Zeenat mentioned, any light peeking through from your window can either keep babies up. It's harder to wind down in the day as it is, but it can also wake them up from their nap. If they're trying to connect to cycle, they're, you know, and any light catches their eye, they're more likely to kind of rouse awake more than we want them to. So darkness is key, keeping their room very plain and simple, and definitely having that routine for them so that they can make that transition to from play to rest. Another one is early mornings, and I always ask parents, what's happening when your kiddo is waking up early? Are they getting to snuggle with you in your bed? Are you going to them immediately? You know, are they getting an iPad? Are they getting to watch TV as soon as they're up? These things are very exciting to babies, and if they're anticipating it, they're going to wake up. So I always suggest that you keep the mornings boring for them. Always have a minimum that you are okay with getting your children up and starting the day. I always say to parents that before 6 is still nighttime. So if your child was to wake up at 6, it's quite reasonable to then start your day. But again, don't put the TV on immediately. Don't take them back into your bed for cuddles. Keep it boring and then start your day. Another thing that is very common with this age group is the pacifier. I work with a lot of 18 months, even kids up to 4 years old who are passy dependent. When kiddos are dependent on something external to fall asleep, they look for that help as they're shifting through cycles throughout the night, even for nap. And ultimately, pacifiers serve a purpose, and they're good for a certain while in the newborn phase. And like Zeenat said, even as the kids are a bit older, but at this point, kids know it fragments their sleep. So even if you put 100 passies in the crib, they're going to wake up looking for it ultimately, and that's fragmenting their sleep. So the way I do it is I do cold turkey. It's often better just to get rid of it. If you keep it for daytime and then take it away for sleep, kiddos get confused. It's better to just get rid of it. And I think that it's harder on parents, the thought of getting rid of the passy, more than it is on the kids. If your child is reliant on a passy though to sleep, it is going to disrupt their sleep. So I always have a plan of action on how you're going to deal with that. Make sure you are ready to deal with it before you do it. And when you do make that decision, don't just keep one just in case you have a rough night, because your child will learn to cry harder until they get that passy. Kids at this age are very aware that their behavior has an impact. So learning to cry harder for something is definitely that something starts to show up at this age. So once you make that decision to get rid of the passy, do just get rid of it. Okay, so then I'll move on now to the 2.5 to 3 year old age group. Common questions that come up: is my child ready to drop the nap? Now, some kids drop their nap at 2.5 years of age. Some keep napping till they're 4. It really does depend on your child. Every child is different. Signs of your child needing to drop the nap is really if they start resisting. If it's been a couple of weeks, they're not really sleeping. They are, chatting away in their crib, or they're resisting it a lot and they're managing to push through till bedtime. That's a sign. If they are napping, but it's starting to impact their fatigue level at bedtime, so they're not going to sleep till 9-10 o'clock at night because they've had a 2-hour nap in the day, that's often a sign as well that they're ready to drop it. You can either start to cap their nap if you start to see it's impacting bedtime, so you can cap it to 1.5 hours. And then if it's still impacting fatigue levels at bedtime, then I would just do away with it. Your child is going to show very, very tired signs around 5 o'clock. They're probably going to be done with the day. So I always suggest give them some fruit around 3 o'clock, give them some natural sugar to push through any fatigue, get them running around outside, some fresh air, and always push bedtime earlier. 6 o'clock is reasonable if your child is giving up the nap to go to bed. Don't worry that they'll be up at 4. It's better to get them into bed before they get that second wind if they're not napping, and it can take between 4 and 6 weeks to get used to that change, so just give it time. Okay, another common question: when should I transition my child to a big kid bed? There's no hard and fast rule that your child is now 2, they need to be in a big kid bed. I always suggest that kids are in beds closer to 3. 2.5 is still on the young side to be in a bed, and to understand the freedom that comes with it, and to really comply with any rules and boundaries that you put into place about going to bed, staying in your bed all night long until morning. That's quite difficult for 2.5-year-olds to comprehend and to even follow those rules. Closer to 3, it's easier to kind of set some boundaries into place. If your child is climbing, if your child has climbed out the crib and they've done it once, it's important not to rush to changing to a bed. If they've done it once and they fell, or they've probably learned that it's not the right thing to do, and they probably won't do it again for a while. If they are climbing out skillfully, there are tips and tricks that you can use to keep them in their crib, whether it's putting a sleep sack on backwards, moving the higher side of the crib if you have a crib that has a higher side to the front, making sure there's no blankets or anything that's giving your child leverage to climb out. I've had kids who have been out of their cribs for a while, being put back into their cribs, even if they've climbed out and successfully they've been sleeping back in their cribs again. It's doable. So again, closer to 3 is best for being in a big kid bed. Bedtime stalling tactics are very common at this age. Kids are learning to push and challenge those boundaries that we put into place. And they like to ask for, can I have another glass of water? Or can I have another book, please? Or I need a snack, I'm hungry, I need to go to the potty again. All these things that you've probably all experienced or are about to experience. The best thing with this is really meet your child's needs before you start your bedtime routine. You want to make sure, and often a visual timer is quite handy in these situations, so you're not always the bad guy. Set it for 10 minutes, and before it goes off, or just give your kids a warning. We're going to start the routine at this time. Now's your chance to grab your glass of water, give them ample time to get a snack if they need it. But then once you start the routine, stick to that rule and do not give in. It's very important that if you put these rules into place, we don't give in and give that water again. So just make sure that you stick to what you're saying and meet their needs before you start the routine. Early morning wake-ups are very common again with toddler clocks, and if kids are in beds, a lot of nightly visits or early morning visits to parents' rooms. Toddler clocks are a great tool to help children know when it's time to wake up or when it's acceptable to leave their rooms. Kids obviously, when they associate morning with sunlight, so if it's bright in their room, you want to darken their rooms up. And you're getting a clock is really helpful. Setting it to a time where it's reasonable for them to get up. Often with toddler clocks, what we tend to do is set the time. Let's just say you want your child to start the day at 7. We set the time at 7, but really they're waking up at 5:30. So that goal to reach to 7 is way too high. So I always suggest that you start where your child is at. Set the time to 5:30, start your day, make it a big deal that it's morning, let them see that clock turn green, celebrate that, let them achieve that goal, and then you can always shift to that clock up 10 minutes every 3 days until they get the idea and concept of the clock going off, what that means, what the expectation is, and shift it then to a more reasonable time until you want to start your day. New siblings, often at this age, mum is expecting or a new sibling has come along. The biggest thing I always suggest to parents is to stick to your routines. Toddlers need structure. They like to know what's coming next. They like to know, they like to be in control of what's going on. And with a new sibling coming along, things are going to change. So the biggest thing you can do for them is really stick to your routines. Fill their attention cup, get some one-on-one time with them when you can. Don't keep them up late with your newborn. Newborns have very, very late bedtimes. Get them into bed on time. Keep those solid routines going for them so that they get the rest that they need and they're not thrown off by anything that's going on around them. But those are the main things that I kind of come across with parents. Hope you found it helpful. Okay.
Okay, next is Dr. Montague.
So we're sort of going to jump a little bit to how to make sleep conducive for your child. And some of what goes on, and I learned this from my sleep specialist, really is not that there's a problem with, their sleep cycles going from the first stage to the second stage, the third stage. It's really just how we initiate sleep and where we sleep and how we sleep. And a lot, like my predecessor spoke about, sort of like what's the room like and what's your nutrition like and what do you do all day. Right now, especially, I think this stuff is so important. I find myself talking, especially to teenagers. The summer was awful because most teenagers were not sleeping sort of nighttime. They were sleeping 2 to 4 o'clock in the morning till whenever they woke up, which was understandable. There was nothing else to do. And they're teenagers. But in order to get back in the good habits for, school starting, they really had to sort of come together and figure out, why aren't I sleeping? Why can't I fall asleep? And kids were invariably, I'm not tired. I'm just not comfortable. I fall asleep. I wake up. And so the terms that most sleep specialists use is something called sleep hygiene, which is exactly like it sounds, like getting clean sleep, getting ready for bed. And what do I do around that time when I sleep? And all of us as adults know what we do, because hopefully we've come from an era of our parents settling us in for the night when it gets dark. And what do we do? And like the ladies had said before, once it starts getting dark and now we have daylight savings time, the melatonin starts to sort of be secreted and you should start feeling tired. And a lot of us at work are like, it's 5 o'clock. Like, why am I so tired? Because that melatonin is kicking in and we want to listen to that. And we don't want to push kids off too late. So the first thing is really starting really early with their signals of when they're tired and not pushing off the sleep too long, and getting them to recognize themselves when they're tired and getting them to bed when they're babies. But as they get older, we sort of leave that to the older kids to do themselves. A lot of parents will say, oh, I don't even know what time he goes to sleep because I'm sleeping before he is. And then those kids come in and they're not sleeping and they're miserable and they have daytime fatigue. So how do we get them back in that phase of sleeping, putting themselves to sleep, and why? And so a thing that's going on right now, especially our kids are doing remote school or hybrid school in their home. So where are they doing their schoolwork? A lot of them are in their rooms and some of them are in their beds all day. When you're in your bed all day, you're less likely to actually fall asleep at a normal time. It's not an unfamiliar place. It's where you've been all day. I'm never tired, or I'm stressed from being in the same place all day because I took a test here, I'm reading here, I'm studying here, playing Xbox here. And so the prime thing is to tell the kids, and even like school age kids, they should only sleep in their bed. They should not be doing schoolwork in their bed. They should not even be for the kids who have true trouble falling asleep or staying asleep, they shouldn't even be watching TV in their beds. I always encourage parents to use the bed for a quiet book, maybe drawing a picture, maybe journaling if they're older, and then lights out, maybe some white noise or some music that they like, and go to sleep. When we take the kids out of their beds, I notice that, out of their beds during the daytime, I notice that they can suddenly get in the bed, it's fresh, it's new, and they actually fall asleep much quicker. The other thing that we're seeing now, and we're all on it right now, is the screen. These kids are on a screen all day long. We're on screens all day now, a lot more than we have ever been, even as physicians. And the screens have all that blue light. It stimulates your brain, and it becomes harder to settle. Some people can fall asleep watching TV, fall asleep on a screen, iPad, whatnot. But a lot of kids get that light into their brains, and it's very stimulating. And we should definitely try to shut off that screen 1 to 2 hours before bedtime, which for most kids, teens, it's harder to get their phones away, to get them to put it down, to actually pick up a book or a magazine or play a game or have a quiet conversation. But younger kids, especially school age, should know that the Xbox has to be done early. I usually say to parents, if they really love video games, they have to play. How about we finish school, we go outside, we have some video games, and then that's it for the screen for the day. The outdoor play is so important. I'm sort of skipping bullets, but I thought that was relevant to now, is that if we don't get daylight into our brains, we don't actually know when it's nighttime. And so it's sort of really important to set that, pineal gland in our head, daytime, nighttime, and what we do during those times. So please go outside and exercise with your kids. Babies should be outside taking a walk, go play, run around with them. I always say that if we role model good habits for our kids, then they're going to do it as adults. So shut those screens off. If you want them to go to sleep at 8, I'd say by 5, 6 o'clock, they should not be on a screen anymore. We also think that it's important to be cool. And one of you guys mentioned 68, 72 degrees or so for babies. It's really true for all of us. We should sleep in a cooler room than a hot room. We shouldn't overdress. We should be comfortable, and we should feel like it's a kind of bed that's just comfy and waiting for us to fall asleep. Older kids can have pillows and blankets. Anybody over 1 can have that. I think that it's good for toddlers to have their transitional object. That's, like you said, not a pacifier. It's something that makes them associate sleep with this thing, whether it's a teddy bear or a blanket or something that mommy carries around inside her that smells like her, and they can cuddle up with it. For older kids, I love talking about meditation. There's a lot of great apps. YouTube has videos for kids, or guided sleep meditation for kids. It just basically teaches them how to breathe and how to stop their brain and turn it off, and really about relaxing all parts of your body, starting with your feet and working your way up to your brain. And that really just, I think more than anything, sets the breathing in motion and then helps them settle into sleep. I always like to have parents even practice it with their kids, and then it becomes a normal routine for them to listen to it on their own maybe, and then fall asleep listening to it. Remember also that we should have regular sleep and wake patterns in the daytime. So, if they wake up at 6 o'clock every day on Saturday and Sunday, they should probably do, the same thing. And that's what our expectations are, and to go to bed at the same time. When we keep our kids up, they do get what your moms always told you was overtired, overstimulated. And if they miss a nap, that's also the kind of thing where they can't settle at night and fall asleep into their regular sleep pattern. And you will find that even maybe for 2-3 nights after that, they can't fall asleep. So maintaining those regular sleep and wake times help. I'd like to remind kids that they grow in their sleep. They love to hear that. And when I talk about that, they're like, oh, so if I sleep and I sleep through the night, then I'm going to grow taller. And you know what? It actually works. So tell your kids why it's important to shut off their brain and have rest. And they're going to be super smart and super tall. And then they actually feel like empowered to sleep. And there's a reason to sleep. Because I have kids who come in and they go, I hate to sleep, which of course to us as adults, we just can't even fathom that that's a thing. But they think sleep's a waste of time. But when we explain why, then they actually want to do it. Also, like I find that parents prolong the bedtime routine. They tend to start at 6:30, 7:30, and the kid's not in bed till 9:30. And what they've found over time is that when we prolong that time of getting ready for bed and reading and doing all the things that we do as a family, the kid's wide awake, wired, and we miss that window. So an hour is way long enough. If it's bath night, brush teeth, have that routine. Routine's so important for all of us. And then they should, know that we do the bath, the teeth, the book, and then we hug or we say a prayer or whatever we do, and we go to sleep. The same thing every single night, but not too long before. When I tell parents to shorten it even to 45 minutes, they cannot believe that they do boom, 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 boom. They still get the same amount of affection and reading it, and the kid falls right to sleep. The other thing parents say is, oh my goodness, they won't fall asleep till 11 o'clock at night. I'm losing my mind. Could be a school age kid, could be a 3-year-old. They're running around, they're crazy at night. A lot of that's related to the screen time and not playing outside enough. But what we say is that, let's say your child's falling asleep at 11 o'clock all night. That's tough for everybody. But what we should do is let them fall asleep at 10:45 for 3 nights, and then maybe 10:30 for 3 nights, and 10:50. And what you'll find is over time, if you do that every 2 to 3 nights and adjust the clock, eventually you'll get them to a time that's more acceptable. It may not be 8. And that's, I think, a big fallacy a lot of parents have, is they think every kid goes to sleep at 8 o'clock. Every kid goes to sleep at different times. It could be 7:30. It could be 9:30. My kids, I was a working parent. By the time we got home, we had dinner, we did everything. It was like 9 o'clock even when they were little, but they did it, and they did great, and they woke up, they were all rested, they took naps. So work out the schedule, what works for you, not so much what the mommy blogs are saying, how they should sleep. It's more about the quality and the quantity of what they sleep than what time they go to sleep. But you have to obviously make it a time so that you're not going crazy too when you get your sleep. I always tell parents that the sleep isn't just for the kid, but it's for us, and it's for you to have a little bit of an adult life when your kids go to sleep as well. So hopefully that helps you guys get your kids to sleep better.
Thank you, everyone. Lots of great questions going on in the chats. Thank you, Zeenat, for answering some of them. A big question that came up was about having your child cry. Everybody's familiar with the cry it out method, the Fervor method that was common, many years ago. Is there a way to get your infant to fall asleep without having to make them cry? Seema.
Okay, so if there was a method that did that, I would be using it, and I'd be a very rich woman. Okay, babies are going to cry anytime we introduce change. Even as adults, we don't like it, we resist it, we get anxious, we're not quite sure, and it ruffles our feathers. It's the same with babies. Learning to fall asleep independently is a skill which they need practice and time to learn. There's not many ways, you can either pull up a chair by your child's crib, you can leave them to cry it out and figure it out. That's not a method that I use, but even if you're right there by your child, helping them, coaxing them through it, they're going to cry because they're letting you know they're frustrated. They don't like it. They're not happy with you. But eventually those cries should, those tears should lessen as nights go on, as that skill comes underway and they start to figure it out. But really it's important to allow your child to communicate that frustration, be there to support them, but also allow them the space to learn that skill. It takes time. It's not easy, but I think also when you're going to make that commitment that you're going to make a change around your child's sleep, stick to it. It's not going to change overnight. If you're undoing 4 months, a year, years of sleep habits that have not worked for you or that have got you into this position, it's going to take a little while for them to learn. So just be patient with it and be consistent. Consistency is key in all of this. Any change that you make with baby sleep, especially if you are taking away the things that they are so used to sleeping with. If you're taking them away, giving them a clean slate to learn this skill, it's going to take a little bit of time. Just be patient and stick with it. Don't chop and change your method.
Thank you. I get a lot of parents who talk about the child waking up, at 2 o'clock in the morning and they can't go, back to sleep without the parent. And the first question I always ask is, well, how do you put them to bed at 8 o'clock? Because if they can't fall asleep on their own at 8 o'clock, they're not going to fall asleep on their own at 2 o'clock. With having the new baby in the house, I'm learning a lot of the new lingo. And my daughter keeps getting emails about sleep regressions. So as babies get a little bit older, as infants get a little bit older, they spend a little less time in REM sleep and they go through the normal cycles. We all wake up in the middle of the night, right? I always tell parents, we make sure the dinosaurs aren't eating us and we go back to sleep. But if we don't know how to go back to sleep, then that's what we have to work on. And it's a lot easier to work on it at 7 or 8 or 9 than it is to work on it at 2 o'clock in the morning when you're exhausted anyway. Okay, so let's talk about, that's more infants. Zeenat, what do you do with an 18-month-old who is waking up in the middle of the night and screaming for mom?
So it does depend on what's going on during the day as well. We do have to look at the nap. How is nap going? And just like you said, how are they going to sleep at 8 o'clock or 7 o'clock? Is mom helping baby go to sleep at the same time every single night? It is likely just a habit wake at this point. There may not be a real rhyme or reason for it, but his body has just gotten used to waking up at 2 in the morning every night. And when that happens, he knows mom's coming in and is going to cuddle me and I'm going back to sleep. So just like Seema said, the consistency really is key in teaching your little one to go back to sleep, whether it's at bedtime or at 2 in the morning. It's obviously a lot more difficult, like Dr. Fierstein said, to stay steadfast in the method that we choose to help them go back to sleep at 2 in the morning. But it's important to maintain that consistency even when they wake at odd hours of the night, so that they're not confused by the method that you're using and they learn, all right, I woke up, but I can go back to sleep on my own. I'm just gonna roll over a little bit and I can get back to sleep on my own. So learning that resettling ability is a skill, just like Seema said. It's so important to learn. It's a skill that will go with them wherever they go. Sleep is so important for them.
Thank you. Dr. Montague, how long can you let your baby cry? Is that dangerous?
I don't know, is it? I don't think so. Which is funny because in the office, right, we hear babies could cry forever and other babies never cry. So sometimes that's just your baby's way of communicating. I think that's just like someone said, one of you guys said that they're frustrated, they're upset, they're annoyed, they're communicating. So I love the Fervor method. I think it's, I don't always call it that, but I don't really even call it cry it out, because I tell parents that they're going to cry the first night that you say, like, this is it. We're going to have our brush your teeth, sit on my lap, read a book, have a bottle, whatever age they are. You're going to put them in the crib and they're going to cry because that's how they tell you, I don't want to be here. And they're going to cry, and they can cry for half an hour. But I think, And what I love from the Dr. Fervor book is to go in there and reassure them not to take them out. If you take them out, then you're just reinforcing that they can cry and you take them out. But to let them cry, go in there and say, I'm here and I love you, and walk out. I tell parents to wash the dishes, do something that is distracting for you for 5 minutes, put a timer on your phone so that it can tell you it's 5 minutes, go back in, I'm still here, I love you. And that first night is torturous. And I think the biggest thing for us as physicians to say is like, we know, we get it, it's not fun. But 3 nights from now, that baby is going to understand that when I'm in this crib, it's for sleep, and they're going to hear, and you're going to hear at 2 o'clock in the morning, and that baby's going to know, like, oh, this is my crib. I think the most important thing is what everyone's saying is when you go to sleep at night, if we rock that baby to sleep and we feed that baby till their eyes are closed and we tiptoe to the crib and we bring them over there at 2 o'clock, they want a bottle, and they want mommy or a breast, and they want to be tiptoed back to that crib. There is no way they understand it any differently. And so they're going to cry for a few nights. I tell parents to do it over a long weekend. Sometimes I get the, oh, my husband won't allow that. Do it go sleep in another room. Maybe you can go to his mom's house. Maybe you can just separate for the night or sleep in a different bedroom. But I also hear it when there's an older sibling. I don't want him to wake the older sibling. The older siblings will wake up the first night too, and then they go back to sleep. So I don't really think that it's dangerous. I don't think it's going to be a problem. I think it's hard on us. And I know I've done it, and it's very hard to do. And I tell everyone the story. The first time I did it all wrong as a parent. And the second time I was determined to do it right. Third night, I'm listening at the monitor, like, is she alive? Is she breathing? And she was sleeping. And ever since then, that kid proved to me as a pediatrician, I would be in the middle of reading her a story and she'd go point to her crib or go night night. And she didn't care if she needed another book, because she knew when she was tired, because they recognize those signals of when it's time to go to sleep. And that's what we want to give them, because we want to do that when you're an adult. I'm tired. I need to go. I need to go to bed. So let them cry for a little bit, and then the rest of their lives, they know how to sleep.
I agree completely. And I've seen it many, many times where the parents then come back and say, oh my God, you were right.
Exactly. That's what they say. They're so happy.
The one thing that is important to mention or re-mention, which somebody did say it, once you commit to it, you really have to do it. Because if you let that baby cry for 40 minutes and then you go in and get them, what you've taught that baby is, if I cry really loud and really long, then I win.
That's with anything, right? That's parenting.
Right. And again, when they walk in the parking lot and they don't want to hold your hand, if you hold their hand, they cry. You don't let them go, because it's important. It's better for them, for them to be safe. And it really is better for them and for all of you to get a good night's sleep. Let's jump a little bit to the older kids. And Dr. Montague, you mentioned COVID, and there's so much anxiety going on. How are you dealing with that when it comes to sleep?
A lot of that today for me, actually. I just came home and my head was hurting from all the mental health issues with this. I try to get them out of their rooms. I think it's really important for them not to do all their schoolwork in their room. I think the teenagers at their age, they want to be in their rooms at school because it's quiet and it's private. But to get them downstairs or wherever, outside, in the kitchen later, out, go and exercise. I think a lot of them they're not doing their sports. I try to get them out, treadmill. I tell them different apps to use to exercise too. Maybe because I do it, so I know a lot about it. But I think just being outside, I think there's something about the sunlight, even if it's cold. I don't ever hear the cold thing from people. Oh, it's too cold. I don't care. Put a scarf on, go outside. Older kids, they're so resistant to taking a walk with their parents or just being out. But meeting friends for a hike or a bike ride, I think, is very helpful. The exercise thing, and I've read a lot of studies showing that if you exercise, you sleep better. I think that's connected to these kids being stuck in their rooms all day. And also the meditation piece. And I had a girl in today who was in college, and I was just telling her about my favorite monk and meditation. And some kids are like, oh, I'm not doing that, so stupid. But I really explained to them why it works and how it works, and being mindful and being in the moment. And that works too. And also trying to a lot of them haven't seen any friends at all. And I know that we're being safe and we're home, but being outside and taking a walk with a friend with a mask on or going on a hike, I think just socially, just their brains are just on overdrive with worry and isolation. And I don't know about you guys, and I know I'm old, but it's not the same when we're just texting. We should be with people. And I think they need to sort of connect. And a lot of the families, I think, are sort of not letting their kids connect so much because they don't trust, not their kid, but another kid. But maybe they can try to find a little pod that they're comfortable with, not in the house. I'm not advocating for that, but really connecting with people outside and then combining it with exercise, walking the dog, something. I think people really need to see people, and they need to have more things out of their bedrooms so that when they go to bed, it's just bed, sleep.
Yeah. And then also, if you look at your kid and you know that this really was an anxious child to begin with, then it may be the time to reach out for help. Your
100%.
pediatrician, like you said, we're dealing with this all the time, and there are coping techniques that can be learned. It doesn't mean you're going into years of therapy.
Right. I tell people sometimes it's temporary. You just need some skills, and then once we get the skills down, the kids feel much better and confident. And sometimes just not taking the worry off their head makes them fall asleep.
Yeah. So that's the older kids, but let's talk about fears with the younger kids. Seema, I'm afraid of the dark. I'm afraid of monsters. There's somebody under my bed. How do you deal with that?
Okay, very common. I think it's important. I don't like monster sprays or anything like that, because that just solidifies that there are actually monsters. You can always take a peek under the bed. If they're scared of things under the bed, put things under the bed just so that they know there's no way anything can even get in there. But at a certain age, 2.5 to 3, I recommend a nightlight. If your child is afraid, you don't want it to be a bright nightlight, just a red or orange tone. Plug it in where it's not going to be in their sight, but just offers some light. Acknowledge their fear. Talk about things that you may have been afraid of as a child, and move on. Be very mindful of what they're watching on the TV. Sometimes our kids have access, free reign on YouTube or, on the TV that they're watching. Just be mindful of what that is. Sometimes subtle things can affect children. It was just recently Halloween. I got a lot of calls from parents who were saying their kids were scared. Kids hear things, talk about monsters and stuff. So definitely acknowledge their fear, talk about, and then move on. Don't harbor on it. You can leave their door open a little bit if you want, if it makes them feel a bit closer to you or less shut in their room if they're afraid. You can play, get a flashlight, play with, make shadows in their room, make a game of it so they can see that they do go away. It's manipulated by the light. Let them feel comfortable, but just move on from that fear once you've acknowledged it. Don't go on about it a lot.
Yeah, excellent. Another trick or tip is, if your child's old enough to draw their monster, then they can draw their monster and then ask the child, how would this, to make this monster friendlier? And they change the color, they give them hats and shoes, and then before you know it, their monster is really not so scary and can become a friend, like some of those movies that we watch with all those kind of friendly monsters. We're going on 8 o'clock, so this is going to be our last question. Zeenat, can you just talk a little bit about nightmares and or night terrors, and how do you deal with those without messing up your routine?
So there's a pretty big difference between nightmares and night terrors. When your child is having a night terror, they'll look pretty glossed over. It's not appropriate to try to wake them up or anything of that nature. But a nightmare, they will more likely be awake because it scared them. It's can be common with certain children. And the best thing to do with the nightmares is to support them through it, let them know that you're there, that they're safe. With night terrors, like I said, you should not try to wake them up. You should just stay there with them, support them through it, let them know that you're there as well. The support really is key to helping them through it, but because they're not fully awake, it's hard to address it in that moment.
Okay, yeah, the nice thing about night terrors is the child won't remember them the next day, so they're not afraid to go to sleep. You might be afraid for them to go to sleep. I didn't ask one important question. I'm going to send this to Dr. Montague. Melatonin, could you address that? Because that question did get asked a lot. Melatonin, Benadryl, Valium, what do you suggest?
Definitely not Valium, not even for the parents. So I get the melatonin question, how many times a day? Yeah. And it's safe, right? So we know there's been study after study that even in kids with developmental disabilities, they actually use it to induce sleep. We all have it. It comes from our little pineal gland that's right here. As the sun sets, the melatonin in our body should start to rise, and we should start to feel sleepy. And it should get higher and higher until bedtime and keep us asleep. But some people don't have enough. Some people ignore it. I think a lot of with the kids is that they learn to just ignore that feeling of sleepiness. And so I'll often say that I know that it's safe. It's fine, but I like to do all the sleep hygiene first. I like to do all of the stuff that we've all been talking about all night about the consistency of routine, sleep and wake times, solid foods, etc., nutrition, getting outside. But if they need to do that to sort of initiate sleep and give the kid, I think, give them confidence that they can actually fall asleep. Now, melatonin only lets you make you fall asleep. It doesn't initiate sleep. It doesn't really help you stay asleep. So the staying asleep thing is a whole different thing. But if you need, I think what it does is it shows a kid, hey, you did it. Look at that. And maybe you use it for a night or 2 or 3. And then once they're good at it, you say, oh my goodness. And I believe I wrote that in a little chat here, rewarding them. You did it. Look how special that was. Like I like to collect like those big jars from Costco and put those little fuzzy balls and they can collect them. And you get 3 nights, you did it. We're going to get a prize. And then now you have to do 6 nights and we get a bigger prize. I mean, not a huge thing. Like I said, special time with mommy is a prize enough. And then sometimes it just helps them gain the confidence to fall asleep. I don't do Benadryl, even for older kids. I think that's dangerous and addicting. I think there's usually good answers. I agree with some blood tests, right? For some kids, iron deficiency has been shown to cause sleep problems, restless leg syndrome. So I do think that we should sometimes look into that. But if we really stay long enough with the patient, we can find out why they're not initiating sleep or sleeping through the night. So melatonin, while it's good to do initially, I wouldn't rely on it. Some of my kids, just as an aside, with attention deficit disorder who are on stimulants, they do have trouble sleeping, even though they're not feeling so much of the effects of that. I noticed the melatonin sometimes they needed if they took their medicine a little late or they needed a short acting later. So for some of you, I think that does help them sometimes. And those are the little exception to the rule for me.
Excellent. Anybody have any last words for tonight? Dr. Montague, anything we didn't cover?
I'm going to say good luck to everybody. You can all do it. I think when we empower people, that's the thing. When I'm with patients and I give them like these little things they can do and big things they can do and tell them they can do it and listen to them cry, they can do it. Every single parent can do that. I always say, as long as your kids don't have developmental disabilities or other things going on and they're growing and thriving, everyone can do it. I think it's more on the parents most of the time than the kids. I think the kids can sleep. I think it's us. So.
Great. Seema, anything?
I think the biggest thing is when you make a decision, see it through, and you don't need to be sleep deprived because you're a parent. I think sleep for your children is awesome for them. It's also awesome for you. You can enjoy your evenings, catch a breath, and have more energy for your kids the next day. If you're tired, if your kids aren't sleeping, you're not sleeping. And I think it's important for the whole family to kind of get that rest that you all deserve.
Thank you. Zeenat.
I agree wholeheartedly with all of you. It's so important to just feel like we have control over our lives again. Being sleep deprived can really do so much damage to us as a whole because we're just always frazzled. We're not enjoying our time with our children. And I think overall, what all of us want is to be able to enjoy every single day that we have with our families. And so just like all of you have said, consistency and patience with teaching our little ones to sleep can overall not only help them, but help us just enjoy each other all over again and make memories.
Thank you. I agree with all of you. We will send out the video tonight. We will send out information how to get in touch with Zeenat and Seema, how to do a consult with them. I always tell my parents that the best, the holidays are coming up. The best gift that you can give yourselves is to get a good night's sleep. And it's well worth the time that it takes to sit with them and figure out your specific instances and issues and have somebody walk you through it. Even if you know everything to do, sometimes you really just need someone to hold your hand. And as much as us pediatricians, how wonderful we are, we can't always be that person for you. And going out and getting a little extra help is sometimes a good thing to do. So thank you everybody for joining us. And Bree is going to make sure you get all the information that you need going forward. Happy Thanksgiving to everybody. Hope you're all keeping your gatherings small. Good night.
Good night.
Bye.